Hi everyone, I'm here to talk about what to do if you find a kitten. Before picking up a kitten, it's important to assess the situation. We use the CASA method. Condition, age, situation, and abilities. Now let's talk about condition. If the kitten is in good condition, that most likely means that our mother has cared for her recently. A good condition kitten is clean, alert, chunky, looks well fed, and in not in visible distress. A poor condition kitten is underfed, dirty, or even covered in feces, and is likely in visible distress or lethargic. A good condition kitten should likely, depending on age, stay with mom until they're weaned. A poor condition kitten will need to provide immediate intervention. Now let's talk about age. Age is going to help us determine the right course of action for the kitten. 0 to 5 week old kittens are very dependent on mom in our nursing. Eyes are either baby blue or not open at all, and they're pretty uncoordinated. The best course of action and the most positive outcome for the kitten is for them to stay with mom until they're weaned. Now let's talk about kittens that are in the 5 to 12 week age. They're running around, they're playing, they're eating on their own, and they're at a great age to take in and socialize. Now let's talk about kittens older than 12 weeks. They're over 3 pounds or bigger. They're sometimes lanky and still growing into their body, or they look like mini adult cats. If feral, it's harder to socialize kittens at their age, and sometimes the best outcome is to get them fixed and release them back into their colony if it's safe to do so. Now let's talk about situation. Every situation is different, and it's up to you to use your best judgment on when and how to intervene. Now, if it's a good situation, that means they have a caregiver, mother is present, and they're being fed and sheltered. A bad situation means the animals were orphaned, maybe the area is hazardous or the weather is hazardous, and this is a good time to intervene. Now let's talk about ability. Your ability and access to community resources are going to factor in on how you intervene. We want to give the kitten the most positive outcome, but also work within your means and capacity. Ask yourself, are you or someone you know able to foster the kittens if needed? Does your local shelter have a life-saving program to take in the kittens? Remember, no two scenarios are alike. There are multiple life-saving pathways for the kittens depending on the condition, age, situation, abilities, and community resources at your disposal. Now remember, when there's kittens, there's cats. So definitely work with a local TNR group and work on getting those kitties fixed so that way we can prevent future births.